I'm Dr. Bentley, an internal medicine and gastroenterology specialist. So how can I help you today?
I'm Molly, I'm 38, and a housewife. For the past several months, I've been having joint pain and stiffness, particularly in my hands and wrists. It's really affecting my ability to draw and use the computer. The stiffness is worst in the morning and lasts for hours.
The morning stiffness lasting for hours, combined with hand and wrist involvement, is very suggestive of rheumatoid arthritis. This is particularly concerning given your profession's reliance on fine motor skills. Have you noticed swelling in your joints, and does the stiffness improve with movement throughout the day?
Yes, my knuckles and wrists are definitely swollen, especially in the mornings. The stiffness does get better as I move around during the day, but it takes 2 to 3 hours before I feel somewhat normal. I've also noticed the same joints on both hands are affected. It's very symmetrical.
That symmetrical pattern is classic for rheumatoid arthritis. Have you experienced any other symptoms like fatigue, low-grade fever, or noticed any lumps under your skin? Also, have you had any family history of autoimmune diseases?
I have been incredibly tired lately, much more than usual. I thought it was just work stress, but even when I'm not busy, I feel exhausted. My aunt has lupus, and I think my grandmother had some kind of arthritis, though I'm not sure what type.
The fatigue and family history of autoimmune disease support the possibility of rheumatoid arthritis. We'll need to do blood tests to look for rheumatoid factor and anti-CCP antibodies, along with markers of inflammation like ESR and CRP. These tests help confirm the diagnosis and assess disease activity.
What exactly is rheumatoid arthritis? I know it's different from regular arthritis.
Rheumatoid arthritis is an autoimmune disease where your immune system mistakenly attacks the lining of your joints, causing inflammation, pain, and eventual joint damage if untreated. Unlike osteoarthritis, which is wear and tear, RA is systemic and can affect other organs besides joints.
Is this going to get worse?
With early diagnosis and appropriate treatment, many people with RA can continue their careers and maintain good quality of life. The key is starting disease-modifying medications early to prevent joint damage. We have excellent treatments now that can put RA into remission or low disease activity.
What kind of treatments are available?
We typically start with disease-modifying anti-rheumatic drugs or DMARDs, like methotrexate, which suppress the immune system to prevent joint damage. Newer biologic medications can be very effective for people who don't respond adequately to traditional DMARDs. We also use anti-inflammatory medications for symptom relief.
Are there any workplace accommodations that might help?
Absolutely. Ergonomic keyboards and mice, wrist supports, adjustable desk height, and software that reduces repetitive motions can all help. Taking frequent breaks to stretch and move your joints is important. An occupational therapist can provide specific recommendations for your work setup.
What about side effects from the medications?
DMARDs require monitoring for potential side effects, including liver function tests and blood counts. However, the benefits of preventing joint damage far outweigh the risks for most people. We start with the safest, most effective medications and monitor you closely.
Will I need to make lifestyle changes?
Regular low-impact exercise like swimming or yoga can help maintain joint flexibility and muscle strength. A balanced diet rich in anti-inflammatory foods may help. Stress management is important since stress can trigger flares. Avoiding smoking is crucial, as it can worsen RA and interfere with treatment.
How will we monitor the disease and treatment effectiveness?
We'll track your symptoms, joint examination findings, and blood markers of inflammation. We typically reassess every 3 months initially to ensure treatment is working. The goal is achieving remission or low disease activity to prevent permanent joint damage and maintain your quality of life.
What's the long-term outlook with proper treatment?
With early, aggressive treatment, many people with RA can achieve remission and live normal, active lives. The key is catching it early and finding the right treatment combination for you. most people can continue working and pursuing their passions with appropriate management.
Thank you so much, Dr. Bentley.
You are welcome. Remember, this information is for educational purposes only and should not replace professional medical advice. Always consult with your healthcare provider for personalized medical care.
Thank you for watching Dr. Bentley's Internal Medicine Life-Saving Cases. If you have any medical questions, please leave your comment below. Have a wonderful day.